Hi, this is my mom, and she's kindly volunteered to be my model for this video regarding surface anatomy. Surface anatomy allows us to locate deeper anatomical structures based on their external features and our understanding of their appearance and location. It's important, especially in situations of emergency first aid or CPR where quick decision making is required and there isn't time to do additional diagnostic testing. Also, surface anatomy can be a useful tool in physical examination of patients that is cost effective and less invasive. So for example, if every time you went for a physical examination, your annual physical, your doctor decided to do full x-rays or an MRI and CT scan or ultrasounds or more invasive endoscopic procedures, if they weren't needed, that would be very time consuming, expensive, and also make the experience rather unpleasant. So I am going to go ahead and palpate and point out some structures on my mom, starting with the skeletal system. We have the zygomatic arch. Sorry if you can turn off. The body and angle of the mandible, the mental protuberance. Most people can easily locate their clavicle. In the muscular system, some features are the deltoid, and many people are familiar with flexing their bicep. Brachiae. Going back to annual physicals, you may have experienced your doctor palpating your suprahyoid triangle, which is the area between your hyoid bone and mandible where they would palpate for swollen lymph nodes, which would suggest an active infection. Additionally, from the clinical perspective, the median cubital vein, located medial to the cubital fossa, is a common site for venipuncture for blood draws. Additional cardiovascular features include the carotid artery, located in the superior carotid triangle, the external jugular vein, that can be palpated in the posterior cervical triangle region, and the radial pulse is also a common area to take pulse, and the radial artery can be located anterior and medial to the styloid process of the radius. And lastly, our textbook brought up a very interesting clinical scenario, the use of an emergency thyroidotomy to open up a blocked airway by palpating for the thyroid cartilage and the cricoid cartilage, and cutting open in the space in between where the cricothyroid ligament is located. All right, thank you, and thanks, Mom.